Let's just start my video and go, hi everybody, lovely to see you all today. Welcome to the 11th of May General TMF Reference Model Meeting. We have a lot of people on the call now, which is great. I think we're at 161 participants, so that's fantastic. You are all muted, so if you need to talk, I believe you can all unmute yourself quite easily. And let's hope that everybody can get in. One thing I haven't done is just keep an eye on my email, which I will do just to make sure if there's anybody that has any particular problems getting in, but so far it all looks good, which is great. Okay, so I'm going to take myself off my video since I've now said hello everybody and happy Monday, and I am going to start the meeting. So this is the agenda for today. Now we've got some real, some quite meaty topics to cover today. So we're not actually going to spend a lot of time talking about the other initiatives. We're going to go straight into the steering committee and have some introductions for everybody on the steering committee. And then we're going to go straight into David Ives presenting on the survey. And then Lisa and Mary Christina and Paul presenting on data integrity with a couple of polls and a little bit of interaction. You've got a chat. Everybody feel free. If you want to make a comment, I'll keep the chat very live. So if anybody has anything they want to add or say, please do just add it to the chat. And let's hope the meeting goes off smoothly and we don't have any Zoom problems. So first and foremost, we obviously had voting for the steering committee, and delighted to say that we have a new and renewed steering committee member group. They're all with their lovely photos, and what I'm going to do is I'm actually going to ask each of them to do a little bit of an introduction for themselves. Some of you might know them, but as many of you are probably new members to the reference model, you may not know everybody. So starting with you, Donna, if you wouldn't mind, please, a little bit of an introduction.
Sure. Good morning, good afternoon, everyone. My name is Donna Dorzinski, and I'm with Just in Time GCP. I'm actually a nurse by education, and I've spent the last 30 years working in drug development, with the last 15 years focusing on document management, as it really is the cornerstone of inspection readiness and GCP compliance. So I'm really honored to be a part of the steering committee and hope I can offer quite a bit.
And Donna, we're delighted to have you on board, so welcome.
Thank you.
And so the next one is Lisa, who shouldn't need any introduction, but Lisa, maybe just an introduction for those people who haven't come across you before. And I'm going to skip over Lisa for the moment, and I'm going to move on to Fran, and hopefully when Fran will come back, Lisa will come back.
Oh, here I am. I was on mute. Oh, is that okay?
Absolutely no problem at all, Lisa. I just didn't know, so I know it's, so over to you, Lisa.
Forgive me.
No worries.
Hey, everyone. Thank you so much for letting me introduce myself and allowing me to be on your steering committee again. I've been a consultant for almost 13 years now and focusing only in TMF management. I've been in clinical trial management or prior to that, or quality management for 17 years before becoming a consultant. As most of you know, I was a co-founder with Karen of the TMF reference model team already 11 plus years ago that produced our first TMF reference model 10 years ago, almost to the day. So thanks so much. And I look forward to, again, representing the many different layers of process, eTMF implementation, and people management into TMF management processes, system, model, etc.
Thanks very much, Lisa. And then over to the far over in the West Coast, in the most lovely spot, Fran. Fran? I'm hoping Fran can unmute herself. Okay.
I'll see. Yeah, I don't know if she's on. Is she on? So.
She's not on.
Okay. I'm going to introduce Fran then, as Fran's been working with all of us on the reference model for many, many years, and she's worked in TMF consulting. She's worked at pharmaceutical companies. She was at Genzyme, and then she was at the consulting company whose name I've completely, Paragon, that's right, and now she works as Advanced Clinical and is always a joy to have as part of the TMF Reference Model Steering Committee. Jamie.
Hi everyone, my name is Jamie Toth. I'm the head of TMF operations at Daiichi Sankyo. I've been involved in the TMF reference model for a number of years now. A couple of years back, led the TMF plan template and currently leading the email guidance with a few others that we're working on. So happy to be here and happy to be involved.
Thank you very much, Jamie. And last but not least, Todd.
Hi, everybody from San Francisco. This is Todd. I'm excited to be back on the steering committee. I've been a part of the steering committee since we got started with it about 6 years ago. I was an industry consultant for clinical research for about 12 years. In the past 8 years, concurrent with my involvement in the steering committee, I've actually been working on software products. And I work at Viva now. I work on the product development team. And I was responsible for Viva Vault eTMF for a few years, for about 5 years. Now I'm more focused on the site software, areas like that. But really enjoyed being involved in many initiatives for the reference model. And looking forward to what we're going to do next.
Thank you very much. Well, thank you again to team, great steering committee team. So with that, going to move into talking about the survey. So David, I unfortunately have control of your slides, so you're going to have to just go ping when you want the next one, please. But over to you. David? Hi, David.
Oh, there we go.
Yeah, no,
I
unmuted you. I have a funny feeling that there was a problem, so I've unmuted you. So there you go.
Yeah, I just said something amazing, Karen, and now it's gone. But no.
Oh no! No.
No, I was just saying thank you to everybody who participated, both in prepping questions, but also importantly the testers. It was a lot to ask, and I'm thankful that people were willing to be. So there is a lot of information in the survey. As you guys know, it's a very valuable tool. Try to extract some of the more sort of pressing topics or interesting things, but the full results will be shared with everybody. So if you can just go to the first slide, Karen.
I'll just guess when we should move on, and then tell me if I'm wrong.
Yeah, yeah, no, it'd be fine. So a pretty good turnout, a pretty good spread across the globe, and as well across the industry as well. So still the largest portion being from the sponsors and in the US, but thanks again for everybody for taking it. So I always find this is an interesting one, asking if your organization has adopted the model as is. The majority of us are changing it, and you'll see later in the deck, there's some organizations that have changed it quite a bit. So I think, the yes, adopted as is has also grown from the past, so that's interesting as well. I think people are just getting more familiar with the existence of the reference model in general. So you can go to the next one, Karen. How many doc types are identified in your index? So for me, the interesting thing here is that there's still sort of a core and largest set of folks who said that they're sticking in the 201 to 400 artifacts range. It's pretty consistent with years past percentage-wise, but it's interesting to see there's just this trend moving upwards, and to see that 10% of folks have above 800 unique artifacts identified is very interesting. I'm curious how people are really managing that. So it continues to move upwards, and I wonder what impact people's use of sub artifacts might be having that, but a lot of speculation here, but it's interesting to see this continue to shift upwards. So TMF of record, this one is telling. I mean, there's a 150% increase in all eTMF operations since last survey. So really amazing how fast, relatively speaking, that shift has taken from, the previous survey. There's still quite a bit of people in the all TMF in paper. I mean, there's still a few there, but the all eTMF is really incredible. Still the biggest majority, and this is pretty consistent, I would say, with last survey as well, is that there's a combination of paper and eTMF, and I'm sure there's lots of reasons why that was.
Just a quick question, David. Somebody's Kyle has asked when the last survey was, and just to sort of, from a reference perspective, we didn't have one. This is effectively a 2019 survey that you're presenting, isn't it?
It is, because we kicked it off sort of the end of last year. Yep. Yeah.
Okay. No, it's just if someone asks a question that's got context, I thought I'd just sort of interrupt if you don't mind. So.
Thank you.
No, it's good. I think the last survey was sort of, it's going on probably 2 years since data was presented, Karen. I think that's probably about right.
Yeah, absolutely. Be interesting to see whether paper goes away, whether paper's had its day with everything going on with the world becoming, so locked down. I do think we'll see people who never used to accept anything but paper might just change their mind now. Anyway, sorry, carry on to the next slide.
Great. This one very interesting. I think there's lots of conversation happens on the thread, the various forums as well, about certified copies, right? So there's the guidance that's out there, but we're all, I think really this is telling, we're taking a quite varied approach to certified copies. So, we've got I think a large still majority saying that they don't have a certified copy procedure. And then the split here between having a procedure that applies to any document filed in the TMF that wasn't created there versus having a certified copy procedure that applies only when an original is irreversibly replaced is pretty much exactly even. So, we don't have time to have the conversation, but I think this is very interesting, and would love to, see how this progresses, over the next couple of years, because I think this is one area where I think get a lot of value out of having more consistency in history.
Sorry. Next one. There we are.
So how are we managing draft documents in the TMF as part of change control? Again, a pretty interesting split, but for me, the interpretive takeaway here was that still relatively few are utilizing eTMF for collaboration. So a lot of people are still using other spaces. And I know there's a lot of implications here about drafts that, we can't really go into, but for me, it remains interesting that the technology is capable, but we don't seem to all be really leveraging that technology. You can go to the next one, Karen. This was a new question for this year, but we were trying to assess sort of what the organizational view of TMF was, and really looking for people to just closely align response here. Obviously, it's hard to do. There's a number of comments here. But I think it aligns with the previous question that a lot of us are still working towards eTMF being supportive of study management and really integrated into the process, and not just sort of this end state repository that I think a lot of organizations are coming from that mindset and trying to shift into, as you can see, with the 32% viewing it as an end state repository, currently working towards it being a project management tool. I think it's definitely interesting, and that's where I think eTMF, we've talked about this before, completeness factor, where it really starts to be successful is when it is part of project management in a more potentially meaningful way. So the next one, Karen. So retaining paper content scanned into your eTMF. Majority of us still retaining paper. Again, another interesting one, and Karen, to your point about how COVID might accelerate this departure from paper. I think that's something that a lot of us would guess we will see for sure.
Hang on, sorry, I've moved it. I have my mouse in the wrong place. There you are.
All right, I personally find this one very interesting. So the question was, do you maintain blinded records in your eTMF? And actually, a majority of people said yes, which is great. People are leveraging the technology. But when you look at the sort of folks that were saying no, the primary reasons were really because people weren't comfortable with the risk and really with the security of the system or even workflow. So the system may be set up to securely handle, but potentially somebody could inadvertently submit something to the wrong person using standard system functionality. So interesting to see how this continues to shift.
Yeah, I must say, I always find that fascinating. People are so obviously so concerned about blinded stuff. So.
This one, again, I think COVID will have and can continue to have a push here where you're looking at remote premise inspection. So quite a few of us have actually had it, which is very different, I think, in years past. But I think, we will definitely see that continued shift towards remote inspections, even if it's, a part of it.
Yeah, what would be interesting would be to actually start counting remote inspections, maybe in the next one, just to see where, what percentage of people have remote inspections every year, and how many.
Yeah,
they have.
Yeah, that would be very interesting. So I have a personal bend on this question, I guess, but it's definitely interesting for me to see, people are still requiring inspectors to complete training prior to issuing credentials. And I think a lot of times what you hear and what we saw here was people saying, well, yeah, it's part of our procedure, so we have to. The interesting thing, I think, is a lot of us have had inspectors say, well, I don't have to follow your procedures. And they're getting so used to the eTMF technology that, I've certainly myself at least pitched a training quote unquote session as a tips and tricks session, just to kind of orientate themselves to help them be successful. But for me, this is very interesting that people are still requiring inspectors to take the training because of their procedures. As well as in terms of inspections, where we're seeing the findings, and this is really pretty consistent year on year since we've been asking this question, but finding regarding TMF completeness continues to be the top. I won't read through all of this, but I think that probably isn't surprising to anybody. Timeliness, I think, has inched up a little bit over years in the past, and I think that's probably because these systems now offer quick access to be able to determine how timely those records are. So that's potentially why this is inching up there.
There's a question from Dawn about your tips and tricks you just mentioned. Do you document it, as in that's what you view as your training in inverted commas?
It's an interesting question. So again, this is a personal experience. We give them like a one sheet that says like, here's the tips and tricks and things I literally just said to you. But it kind of depends. I mean, we're pretty reliant upon our partners, and some of them are very much like require we have to have a piece of paper signed. For our last, it was really inspection, we had to sign a piece of paper. It really just said, David provided session to the inspectors, and they just signed off on it. But again, that was driven from our partners' procedure, not necessarily our own.
Okay.
I think this is one where we're going to continue to see an increase here. where people are, a lot of folks really undergoing joint inspection with a partner, so a CRO or sponsor, depending on which side you're on, where it's not just you were part of this study, so you're therefore roped into some components. It was actually where people were seeing this as equally subject to the inspection. So I'm going to inspect you both at the same time. And I think this is something that's continuing to increase with the focus on vendor oversight. I think this is an interesting one from a perspective of, these growing data pools in our eTMFs, and the question was really about if you're using this for your risk-based monitoring program. And quite a few people actually are, so 19%. For me, I would have guessed maybe less. And then, people may not be currently, but are in the future. So I think this will probably continue to grow year on year, but personally, I was surprised that so many of you are. That's great. And then, I can't remember, Karen, if this is the last one or not, but do you measure metrics on CRO performance? This kind of ties into to what I was saying about sort of under management, at least from the sponsor side. More and more people are absolutely measuring some of the CRO performance, so at least a small majority, yes, although you said no. And I think a lot of the no's, at least some of the commentary I saw was there wasn't sort of agreement between the sponsor and the CRO on what those metrics and thresholds should be. But I think, again, as people's technology continues to evolve and their use of it evolves, we'll probably see this continue to shift because of that focus on sort of, they're all part of the same study team. We need to be looking across, not just looking at one component versus the other.
Huh.
Made it. Karen, I know there was a lot there. I hope I got through it pretty quickly, but I think there's a lot of interesting content in there, and we will get that shared up, but this was the cut that we tried to put them sort of more topical pieces out in front.
Right, and that's brilliant. Thank you, David. So a question is, I'm assuming that will all the answers be posted to the reference model website so people can go and download them?
Yeah, I don't, we wouldn't do that. I know in years we had asked for people's emails who were interested in getting the results, and we did that as well here, but I don't see why we wouldn't be able to post them.
Yeah, no, we should be able to put them on the website. I'm sure Eldon's on here, and I'm sure Eldon will tell me that it's fine.
He did.
He did he? Okay. Oh, thank you. Sorry, I obviously was looking at the wrong place. Yes, thank you very much. Thank you, Eldon. Right, okay, brilliant. So thank you very much, David, much appreciated. And we are spot on time, so that's brilliant. And I am now going to hand over to Lisa Mulcahy, Marie-Christine Poisson, and Paul Fenton to talk about data integrity guidelines. I'm afraid, guys, I'm your slide mover again. I don't think I can give you the control to...
No worries, it's not hard. It's fine.
Right.
Do we have MC on the line? I was perusing the participants.
Yes, I'm here. Can you hear me?
Oh,
Yes,
fantastic.
absolutely.
Yes, thanks, MC. Hi, everyone. So this is Lisa Mulcahy, and I've been asked a few times about the data integrity guidelines and specifically the reference to audit trails. So I proposed that this be a topic. And today I'll be doing the foundation, and MC and Paul will be filling in from their different perspectives. So we're going to start off by a poll. We know that we love to get polling information from the people that are on the phone. So if you would, Karen, please initiate the poll.
I have done so.
So the poll is, has your company evaluated the FDA and MHRA guidances on data integrity as it pertains to the TMF management system and processes? I'm guessing this is a select one only option.
Yes, it is a select one only.
So Karen, I'll let you decide when we have enough people
Absolutely.
to actually have the conversation about it.
Yeah, no worries at all.
And present.
We're on about 70 of 177 at the moment. So I think we can probably get to over 100.
Keep going, everybody.
We're getting there.
There is an option for you don't even know, and that's okay. So if that's the situation that you have, then just make sure you indicate it as so.
89. I'll pause it as soon as 95.
Come on, come on. This is
97.
like your public broadcasting, you know, request
99.
for funding.
One more.
Come on, one more.
One more. Right, done. I'm ending the polling, okay?
Fantastic. So let's see these great, interesting results.
There you go, and share the results.
Okay, everyone. So as you can see here, nice. Really interesting. So I think 21% of us on the line will find a little bit of this presentation or this introduction to be interesting, since you haven't yet evaluated them or that you haven't had the time to do it. So hopefully we're going to just help you jump into that so that you're comfortable. Glad to see that some decided that it doesn't apply, that you've reviewed it, and those that reviewed it and decided it does not apply as well. So if you haven't reviewed it or you have, and I'm really happy to see that a third of us that have joined today have indicated that you've reviewed it and you've tweaked a few things, including actually some of those that made some major changes. And then we have the other group, and maybe you just don't know, but that takes us to an action when we go back after the call to see what our organization may have done. Or maybe you kind of like me, I didn't respond, don't have any responsibility for my own organization, since I would advise that to other clients. So let's go on. Let's close that up.
Okay, hold on one second.
That was interesting.
Stop share results. Right, so
okay, next slide.
Next slide, right, there you go.
So everybody, there's two major guidances that have come out in the last 2 years to 18 months. One was by the MHRA 2 years ago, 2+ years ago, which is GXP data integrity guidance and definitions, and I provided that link. And the FDA came out with one that was sort of reference to the GMP field. However, we all know that in TMF management, we do take a look at all those other record management guidances and available documents, regulations, so that we can do the best as it pertains to our system for management of TMF content. Next slide.
Oh, hold on. Sorry, my mouse was in the wrong place. There you go.
Oh, good. So what is data integrity? And I know I'm going to present you with a lot of information. I'm really just going to highlight that information on these slides so that you can come back later. But I felt that for those of us that are reviewing these slides later, it's good to have actually what is in the guidances. So data integrity from the MHRA, as their definition, is the degree to which the data are complete, consistent, accurate, trustworthy, reliable, and that these characteristics of the data are maintained throughout the entire data life cycle. It's important that that data is collected and maintained in a secure manner, right? So that it is attributable, legible, contemporaneous, original, and accurate. So it's the ALCOA plus. Okay. And if we go to the FDA states that data integrity refers to the completeness, consistency, accuracy, kind of ALCOA, right? The whole first part is about ALCOA plus. And data integrity is critical throughout they say CGMP data lifecycle here, but also what is important is they talk about the creation, modification, processing, maintenance, archival, retrieval, transmission, and disposition of the data. So the entire lifecycle of the data. Next. So what is data integrity? It's not about identifying or falsifying records and how true your record is and kind of identifying whether or not data is false. Okay, it's not about just the data, the file, or the record creation. It is about the data, the files, the records, and also the metadata and the audit trail associated with that creation, maintenance, movement of the file or record. And I'm just going to give you a quick example. It's the transfer of records from one location to the other. So it includes all of that, but just as an example, I have a client that is moving content from a CRO to a file transfer location, and then to their eTMF. And it was really about identifying and really getting the information associated not only with the PDF, not only with or the native file not only that document going through, but also the information associated with that document's management, its metadata and its files, and making sure that you have a very qualified process going throughout the entire life cycle of that data. And that was only one piece of the data integrity process. So we have that whole piece in front of it, which is the creation, the management of it. And then we have the whole piece after this life cycle, which is all the way through maintenance or management in a system, and then its disposition, its archival, and ultimately all the way throughout destruction. And then I found this website, and I thought this was a really great quote, and I'm going to ask you to read it later, but there's many ways in which data and documentation can become damaged or inaccurate. And they give you lots of different ways that it can. And so data integrity is about ensuring that it does not become damaged or inaccurate, or that you don't have the same amount of documentation or data that you had prior and you no longer have it. And the very last line is very important because it can be damaged or lost due to just good old human error. So we have to, as part of good processes for management of data and the information around it, manage the possibility of human error. Next. So data integrity as it applies to the e-systems and the audit trails, right? So an audit trail, as we all know, means a secure computer-generated time-stamped electronic record, and it allows for the recreation of the course of that event, of that data or that documentation, okay? And it includes those that track creation, modification, as well as the people, the record name, the people who, the users, the system actions to manage that record in that system. Next. The MHRA goes into much more detail, so I'm going to have a couple slides on the MHRA and what they put in there. And the audit trail is a form of metadata, right? And what that means is information about the record, so data about the record. And it is also associated with those that is related to the creation, the modification, the movement, the deletion of the GXP records. And I'm going to put movement in there. An audit trail provides for secure recording of the life cycle, okay? And you know what? They've also added in here that it includes paper. It's not only systems, but it also includes paper, okay? And you have to make sure that you're not overwriting the original record. And the audit trail facilitates reconstruction of the history of such events. They basically put it back to the who, what, where, when, why, how, etc. Next. So they talk here in the MHRA guidance where computerized systems are used to capture and process, report, store that raw data electronically. Systems have to be designed to provide for the retention of those audit trails, okay? And that items included in the audit trail should be those of relevance to permit reconstruction of the process or the activity around the data or documentation. And they give you examples up top, especially around the reason why a data or documentation will be changed. Next. Audit trails identified by risk assessment as required should also be switched on. So the MHRA, I'm sure, through this guidance has identified systems that did not have their audit trail switched on, and they're making a statement that they should be. So every time I look at something from MHRA, it's because they've experienced something where they have identified a gap. And the gap that I see here is that the MHRA identified systems that did not have their audit trail switched on. And they also write that the relevance of the data retained in the audit trail should be considered by the organization. And that's where we're going to go to one of the things next. And that's to permit robust data review and verification. So we have to make sure that the information in the data in the audit trail is important to the actual audit trail that it is documenting. So the data or the documentation that is monitored through that audit trail. Next.
One sec. Yep. How about?
So this is where it gets a little tricky, and we're trying, and that's what spurred the discussion today, is the direction that data review should include documented audit trail review to determine, and where this is determined by a risk assessment. And so how does that apply to e-systems, especially the eTMF? And they say that those who review the audit trails should have sufficient knowledge of the process and the systems to review it. So you just can't say, hey, go review this audit trail regarding the business process, but the person that's reviewing it doesn't really understand the business process or whatever process there is in place. So for example, if you're reviewing an audit trail of a person that has access to a system, then you should understand the process for the access to the system and then that person's role and responsibility within the system. Okay. Next. Okay, so I've given you a little bit of that foundation. Now, how does that apply to the eTMF systems and processes? So how do audit trail and the oversight from a data integrity apply to eTMF management systems and process? And I just want to let you know, the data integrity guidances include much more than just that around the audit trail. So I really would suggest that everybody take a look at that data integrity guidances to see where that impacts your own processes. But MC is going to take us through a case study as it pertains to Pfizer. Oh, hey, you know what, MC? I dropped off your Pfizer company on there. Please forgive me.
That's okay.
I'll make sure that's updated. Oh,
Absolutely.
I'm so sorry.
No,
hey,
no
Karen,
worries.
Will you make sure you update this before you post?
No worries.
Appreciate it. Okay, next slide.
Oh, okay. So it's a busy slide, but I only have one slide. Yes, can you hear me?
Would you just give a little bit of your introduction and why, you know, from your perspective?
Absolutely. So, well, first of all, so my name is Marie-Christine Poisson-Carvajal. I'm the head of TMF operations and registry at Pfizer. And so what I want to do today is to really tell you, you know, what is our approach regarding audit trails at Pfizer and specifically for TMF, right? I mean, nothing else. I mean, it's just really specifically to TMF and how we actually decided to respond to the regulators' expectations when it comes to audit trails. So the first thing that we did is actually to create an internal document that actually contains definitions, but also actually describes the types of reports that we generate, whether they're standard reports or ad hoc, and how we use actually the information and data that is contained in our system to analyze, assess our performance, the health of our system, how our controls that are in place, how they work, do they work properly, and how we use our audit trails to actually course correct or actually decide to make enhancements, changes to our internal system. So we divided this internal document in 3 main components. We also actually wanted to make sure that we provide reports or audit trails that are legible, readable by individuals who are not necessarily fully familiar with our system. So that's something that the MHRA really has insisted on, is to make sure that whatever audit trails you generate and you provide to them, they have to understand from just, you know, looking at the report what it is about. So making sure that the reports are generated in Excel format with defined column headers and no merge cells, so the users can actually query the reports and sort and filter very effectively. So that's kind of the logistic of those reports. In terms of the types of reports or audit trails that are generated to assess performance and and making sure that the controls work properly, they could be used in different ways, right? So we have a full list of standard reports that the end users of our system can generate at any point in time during the life cycle of the study, or on a specific study TMF, or at the program level, etc. And we can really track and report on every single transactions, actions, and tasks that is being done within the system. And you have some examples described here on this slide. One important aspect of audit trails that inspectors are really looking after is your workflow history. You know, kind of being able to understand from start to finish what happened to a particular set of data, the metadata associated to a particular document in your system, and the document itself. Right, so having this traceability of all of the different tasks that have been performed on a particular record within your system, and being able to generate that whatever it's requested, but also for your own internal use, to really make sure that actually your system is always working properly as expected. So you can actually have those reports and audit trails kind of, aggregated together to produce meaningful reports to help manage and monitor the study TMF. And you have some other examples here. One aspect that is also very important is being able to, it's not only about data, metadata, and records, it's also about the user accounts and making sure that you have total actually control on who is doing what within the system, and being able to show evidence of the system roles, privileges, etc., of individuals who have accounts in your system. So this is how we've done it. Again, we have an internal document. We have also a slide deck that we kind of keep on the side, and if regulators are asking during inspection, hey, by the way, what do you do with your audit trails? How do you review them, and for what? Then we have a slide deck, a presentation that is ready for being presented in case we have that type of question from inspectors. So that's in a nutshell, and would be very happy to answer any questions that people may have. But even offline, you can reach out to me. But this is how we have decided to approach that at Pfizer. Back to you, Lisa.
Thanks, MC. Hey, you know what, MC? I just learned something, is that I haven't had that backup slide deck ready. So really good. Reminder that that's a great idea, especially the MHRA, who would definitely come in and ask for that. Yeah. Hey, I love that. I love that, because you are using it, right? You are using it, so why not just put it in place? Thanks, MC. We'll take questions at the end. Paul Fenton, Paul's CEO of Montrium, and take it away from a TMF system perspective.
Sure. Thanks, Lisa. So as Lisa said, I'm the CEO of Montrium. I'm also the co-chair of the eTMF Exchange Mechanism Standard subgroup. And so data integrity is definitely something that's very close to my heart. I think that there's a lot of challenges when it comes to data integrity for eTMF solutions. I think the first is, what data should we be collecting? And I think, an eTMF is a big system. There's a lot of transactions, a lot of things happening in that system, a lot of people working in that system. And so collecting every single action in the form of an audit trail or an activity log could be pretty significant. We could be talking millions upon millions of entries and data points. And then we need to kind of work out, well, who can access all of that, both internally as well as, when it comes to inspections. Maybe not everything that you have in your activity logs, should be surfaced during an inspection, or maybe it should. It's not really clear yet. And then I think the other challenge that we have is obviously how do we access it in a manageable way, given the vast volume of information? For it to be easy to understand, easy to find the information quickly, and easy to be able to report on it. And I think that this is definitely something that is evolving. And today, I would say an educated guess that the systems may not currently capture all of the data that's required to demonstrate full chain of custody. And the reason why is because this typically goes beyond the traditional requirements of audit trails that we see in Part 11 and Annex 11. Next slide, Karen or Lisa.
Me.
Yeah. So I wanted to focus specifically on the EMS, the Exchange Mechanism Standard, because we do, of course, address the transmission of audit trails, which is really important for data integrity within that standard. However, the way it's been designed is really based on the traditional view of audit trails that we see in Part 11 and Annex 11, so the creation, modification, and deletion of records. And you know, a record in a TMF system is usually created kind of at the end of the process. There's a whole bunch of other things that are happening prior to something being declared a record. And that today, from a regulatory standpoint, would not be considered part of the formal audit trail as required by Part 11 and Annex 11. So we need to think carefully about what information we should store in the audit trail versus kind of an activity log. And maybe it's one and the same thing. And it's something that really needs to be defined by, I would say, the system vendors and their clients. But once we can kind of work that out, then I think it will be easier to be able to demonstrate, you know, the full transaction on every single record in the TMF. So next slide. So this is, it's not very user friendly, but this is what an audit trail entry looks like in the Exchange Mechanism Standard. So we see the traditional stuff, so an ID for the audit trail entry, a date and timestamp with the time zone offset, a user, the type of entry, and then we had this tag for audit event. And so what we're thinking as a group in the exchange mechanism is to maybe expand the use of this audit event to capture other actions or transactions that have occurred on an artifact. So this could be, you know, when the artifact is received from the site, or when somebody does a review on a draft document. You know, we could potentially integrate it here. I think it's also maybe interesting to think about standardizing types of events, such as artifact upload, artifact viewed for blinded documents. It's important, you know, or artifact moved. And if we could have a list of these different types of events, then when transferring from one system to another, the receiving system would be able to understand what the event is all about and then represent it accurately in an audit trail. And then the entries, of course, could be prior to an artifact being declared a record, which is not the case today. And I think finally, if we can standardize these types of entries, then it's going to make it a lot easier to transfer all of the data and ensure data integrity. So with that, I'm going to hand it back to Lisa, who will conclude the presentation.
Thanks, Paul. So Karen, we are at 6 minutes of the end of the hour. Didn't know if there are other questions that people might be asking. I see a couple things, which is, Paul, it says that somebody added the comment that it sounds like the TMF reference model exchange mechanism is a good way to handle transport as part of data integrity. And you went through that. So
yeah,
they said that even before you started. So I was really happy to hear that. Go on.
That's great.
The second thing is that I just wanted to know if anybody has any, and Marie, MC, if you would like to comment on this question. If you are transferring files electronically from a CRO to sponsor, would you also need to request deleted documents? Have you any experience with that?
I'm sorry, say that again, Lisa? Would you
Yeah, I'll read the question again. If a company is transferring files electronically, you know, the data and the documents from a CRO to a sponsor, should the request for deleted documents also come along in that request?
I mean, the expectation is to actually have an audit trail that comes together with the transfer of the actual records or data. We've seen that actually recently with a divestiture, and the receiving company asked us to provide not only the records, but also the audit trails that go together with the transfer of documents. So yes, I would say that you have to actually accompany your transfer of documents together with the audit trail that shows the movements, transactions, etc., and changes that may have occurred, including the deleted documents.
Thank you.
That's an interesting question, Lisa, because you wouldn't expect deleted document. You wouldn't expect the actual documents to go over because they'll be deleted for a reason. There might be because there's personal identifying information, it could be in the wrong study, etc. So you'd only want to know the record of what's happened as opposed to the actual.
You may not have the document itself, but you may have a traceability that many documents have been deleted for those reasons.
Yeah.
Right, and the audit trail around those unique document IDs in the system.
Yes.
I would be more comfortable with that, me personally, because the documents were deleted according to a process that you've defined, which means that they had some reason. I do know that, you know, some systems are not able to provide those deleted documents, and whether or not that's right or wrong is another discussion, but they cannot, it's a hard delete. And so virtual deletes are different than hard deletes. So I think your process has to define what you would be willing to provide. However, like you said, the audit trail would be there to define those or identify those that were deleted. And specifically, somebody asked about a system and whether or not, but I would leave that to a discussion with you and your specific system, business administrator or system administrator. So I'd like to talk generalities right now instead of going into specific system capabilities. So I think that pulls us up. So thank you, Sabrina. I hope that you'll understand. Karen, I think we are done at this point, and I'll give it back to you to close the meeting.
Well, I have to say, guys, that is absolutely perfect timing, as always. Just a couple of things to say. There's a couple of meetings coming up. There is a virtual DIA. I'm sure those of you who are maybe presenting might be aware. We actually have a session at the virtual DIA. Fran Ross is running it, and I think it's Jamie, myself, and David Ives who are presenting on the TMF reference model, history, usage, etc., survey, etc., etc. So hopefully, I don't know how it's going to work, but hopefully you will be able to join in. There won't be a 10-year and birthday party though, because although we could jump on a Zoom call and celebrate together. There's obviously still some other conferences. I don't know if any of these are cancelled yet. I say yet because I'm guessing some of them will be. But keep an eye, as Eldon has just pointed out, there's an events feature at the bottom of our webpage. Please go to our webpage. I was looking at the metrics today with Eldon, and it's amazing how many people are going on and looking at things, but do go and have a look, tmfreferencemodel.com, and you will be able to find all the information. Thanks, Dawn. So Clinical Documentation World is going to be virtual as well. And I have to say, having looked at a virtual conference recently, I attended one on virtual clinical trials. It was amazing, the way you navigate around and go and see the booths and everything. However, there was a question, Dimitria, are the events free? Unfortunately not. They're all run by events companies, and so they're going to have to charge to cover their costs. Yes, Jamie, there's a TMF week in June, which is virtual as well. So I think there's quite a few events going on around the globe, but I'm guessing they're mostly going to be virtual at this point in time. So with 1 minute to go, it just means, ladies, need to say that the next meeting is going to be the 22nd of June. and we will be talking about some of the new initiatives that we've got and some changes to the reference model. So please come along, put it in your diary. It'll be you'll get a notice on through the website, etc. And it just remains for me to say, everybody, please stay well, stay safe, and look after yourself, and take care. So thank you very much, everybody. Nice to see you. Take care.
Thanks. Bye, Karen.
Goodbye, Karen. Goodbye, everyone.
Bye all. Bye.